Central PA's People and Perspectives podcast, produced by the Cumulus Harrisburg News Department.
Good morning, and thank you for joining me for today's edition of People and Perspectives. I'm Christine Rookie, and joining me this morning is Dr. Bethany Cunningham, pediatric gastroenterologist with Penn State Health, and Caden Hartley, Crohn's patient and this year's Take Steps for Crohn's and Colitis honored hero, and his mother, Natasha Hartley. Good morning.
Good morning.
Good morning.
Good morning.
Now, Dr. Cunningham, when we're talking about intestinal bowel diseases, in particular Crohn's disease and ulcerative colitis, it's reported by the CDC that more than 3 million American adults are currently living with these diseases, and an estimated 80,000 children are also diagnosed. While these numbers, to me at least, seem large, unless you know somebody who's been diagnosed or you yourself have been diagnosed, I feel a person really never has heard of Crohn's or colitis or understand what the disease truly is. Can you first tell me what Crohn's and colitis is?
Absolutely. So Crohn's and colitis or ulcerative colitis are part of conditions known as inflammatory bowel disease altogether. They're autoimmune conditions that occur in a person who has a genetic predisposition, and they have inflammation that gets turned on in their GI tract, and then they can't get it turned off. For Crohn's disease, this occurs anywhere from the mouth to the anus, so the entire GI tract. Whereas an ulcerative colitis is pretty much just the large intestine or colon. Most of the effects of the disease are in the digestive tract, but there can also be issues with joints, skin, bones, kidneys, livers, eyes, kind of just to name a few of them. And then extreme tiredness can also be a major issue for these patients. And they are chronic, incurable diseases that can be quite debilitating for some patients, particularly while we're trying to find the perfect treatment regimen for that individual.
So when we're talking about all the ailments one could potentially suffer by having an IBD, it might not be easy to diagnose, especially if your symptoms aren't affecting your digestive tract alone.
That is definitely true. We do have, it takes often longer for patients who do not have classic GI symptoms to be diagnosed. We sometimes get referrals to patients who present to ophthalmology because they have inflammation in their eyes or something like that. So it can present as a predicament for us to get a timely diagnosis in these patients.
But you do work well with your patients to make sure you are treating them the best you can, correct?
Oh, of course.
Okay. And I hear from people, maybe, I wouldn't say a lot of the times, but often enough that it sticks with me. I myself am a Crohn's patient, but they'll be like, oh, I suffer from IBS. Just change your diet. That's what helped me. But really, there's a difference between an IBD and an IBS, correct?
Oh, absolutely. There's a big difference between the two. It's very common for people to be confused about them because the names are so similar and some of the symptoms do overlap. Generally, though, there's kind of red flag symptoms that we look for in relation to IBD, such as things like blood in the stool, weight loss, unexplained fevers, loss of appetite, and then belly pain or bowel movements that tend to wake patients up at night, not just during the daytime. And sometimes they can have vomiting, specifically if it's preceded by abdominal pain. They also will have issues with pain around their anus. And in children, particularly, we look at their growth charts and they may have really poor growth. IBS, on the other hand, is typically abdominal pain, diarrhea, or constipation that's caused more by a hyperexcited nervous system in the GI tract. And so the treatments are very, very different. And we look for, on our diagnostic testing, when we're looking at these, the key thing that we're looking for is inflammation. There's inflammation in inflammatory bowel disease, but there's no inflammation when it comes to irritable bowel syndrome.
Yeah. So these are diagnoses that you're not just throwing out there like, oh, let's call it Crohn's or colitis. You're really taking your due diligence to make sure you're finding it and treating it well. Talking about treatments, what are the type of treatments that are available to some patients these days?
Oh, treatments. Yeah. So it is a limited number of treatments actually for patients. So it is important that we make the right diagnosis and that we are pretty aggressive in treating so that we can get that disease under control. Right now, the first thing you need to do is knock down the inflammation. And some medications that we use to do that are things like steroids, nutritional therapy, which means pretty much drinking only formulas, and then some of our biologic medications, which you may have heard advertised on TV for various autoimmune conditions, but things like Remicade, Humira, Entyvio, Stelara are some of the ones that we use to kind of knock down that inflammation. And then once that inflammation is knocked down, we have to keep that inflammation away. So in very mild cases, sometimes we can use medications called aminosalicylates, which are kind of like a topical medication for the intestines. And historically, we've used medications like that are immunomodulators, like methotrexate or 6-MP. They're generally used now more as adjunctive therapy with the biologics, that Remicade, Humira, those types of medications, because those can not only induce remission, with knock down all that inflammation, but they're capable of keeping it down and have been shown to give us our best long-term control of the disease.
And when we're talking about remission, it doesn't mean a cure. Someday down the road, the medicines might stop working or you always have to take it. I mean, so it's a lifelong disease really for anybody diagnosed.
Yes, this is totally an incurable disease as of now. Hopefully in the future that won't be the case, but as of now, it's managing a disease, not curing a disease. And so there's always chances for recurrence of symptoms, and it was definitely lifelong medications is what we're looking at.
And when we're talking about the typical age of somebody diagnosed with Crohn's or colitis, I say it's typically between 15 and 35. I think that's what all the reports say, but it can happen to someone much older. I've heard of people in their 70s getting diagnosed, or much younger. Now, Dr. Cunningham, what do you find is your experience working with pediatric cases?
Yeah, most of our patients tend to present between, I'd say, 11 and 17, but they are starting to present earlier and earlier, it seems. The youngest patient I've diagnosed and managed was about a year old when we diagnosed them. We're not totally sure why that's happening and why it keeps pushing earlier. Some reasons that have been considered are the hygiene hypothesis, which you may have heard of in other contexts, where our environment has become so much cleaner that we're not being exposed to as many germs. So there's less infections, but it's also causing an increase in allergic and autoimmune diseases. Other things are the increased prevalence of the Western diet, which contains more pro-inflammatory foods like processed foods, greasy foods, red meats, things like that. What we find with the younger patients, though, is that they're often sicker and it's often harder to get their disease under control. So continuing research in this population, which is very difficult because of regulations and just caring about the safety of our children, not wanting to try things out on kids, it's a bit of a challenge, and that research is very important so that we can continue to identify, maybe prevent at some point, but definitely treat and manage these children with what can be a fairly devastating disease.
Well, that would be great sooner in the future than later in the future to identify and maybe find a cure for especially the younger generations of Crohn's and colitis patients. And because you also mentioned that one symptom might be they're not hitting their growth spurts like they should be, which could be detrimental physically and mentally.
Absolutely. We definitely focus on the growth curve. In pediatrics, we talk about, that's another vital sign. There's heart rate, there's respiratory rate, blood pressure, but growth is just as important in these kids. And so, especially in pediatrics, we try to make sure that we get on their treatment quickly and as effectively as we possibly can so that they grow to their maximum potential, both physically and mentally, and that they go through puberty appropriately and all of those things.
Now, Kaden, you are one of Dr. Cunningham's patients. I'm sure you're thankful that you and your parents found her. What do you think of Dr. Cunningham?
She's really nice and helping. She's understanding.
Now, I know your journey to find her and get to where you are today was not an easy one for you. I know you were diagnosed with Crohn's disease when you were 11 and you were having issues at least 2 years prior to that. Do you remember how you felt?
Yes, I was confused why I always had stomach aches and stuff.
And Mom, Natasha, how did you feel? I know you've talked about that this 2 years period that you were noticing he was having issues with his bowel movements, with not even growing. How did this make you feel as a mom looking at your son and you're going to your regular doctor and they're kind of like, oh, that he's fine?
Yeah, it was really frustrating. And like I said, he was having issues for almost 2 years before that. He wasn't gaining any weight. I think he hadn't gained any weight for about a year. And he was just really skinny and he wasn't eating right and regularly. And it was actually really scary. And, deep down, I knew in my gut that, something was wrong. And so when I brought it up to the doctor, he kind of didn't really want to believe me or, do the test that I asked for. So that was also very frustrating.
And that kind of surprises me, especially because you do have a family history on your husband's side. So
yeah, that was, confusing to me that he didn't take it seriously. But we did go back and we started seeing Dr. Stephen Heverly at Tannen Garcia, and he was the one who actually took my concerns seriously. And he actually set Kaden up to get, some tests done and stuff like that. So that was a relief.
And when we're talking about Kaden's stunt in growth in essence for 2 years because he wasn't putting on any weight or anything. Was it hard for him to get involved in other activities because I'm assuming he was tired and just no ambition?
Yeah, he really, I think, in my opinion, his confidence wasn't there. You know what I mean? It was, yeah, definitely hard for him, for sure.
And now, Caden, you have infusion treatments. How often do you get that done? Does that help make you feel better?
Yeah, I get it like every 8 weeks.
And how long have you been doing that?
For almost a year now.
And so would you say that you feel better now that you're getting in the infusion treatments? Now we know this isn't a cure, but does it help you?
Yeah, it helps me like eat a lot, like eating a lot better and stuff.
Yeah, he's also gained a lot of weight back, and he's at his the normal weight for his age, which is really nice to see.
Now, going back to getting your appetite back, because I love me some good food, love cherry cheesecake. But what is your go-to food that you love now that you can eat again, so to speak?
I have no clue.
He likes everything. He loves biscuits and gravy.
Well, that certainly sounds tasty. And Caden, you actually just wrapped up school. What grade are you going into in the fall?
7th,
And what type of activities do you like to do now that you have your weight and energy back?
like soccer, sports in general, like going outside and stuff, hanging out with friends.
And of course, this year, Caden, you're also the pediatric honored hero for the upcoming Central PA Take Steps Walk that is taking place this Saturday. That's June 25th. How do you feel about being the honored hero?
I'm not sure really. We're still new to this, but I do feel honored to be picked this year.
And of course, I assume your parents are coming out, your sister. You're looking forward to seeing the events that are going on?
Yeah.
Because as you mentioned, it is your first year going to the event, but there are lots of kids there that are around your age. So maybe inspiring to have people that maybe don't know your story learn about you, or vice versa. You know, you see other people and you're like, wow, there's other people, quote unquote, like me, even though all of our stories are different.
Yeah.
Now, I know your story itself is on the Take Steps website. If somebody listening to this program wanted to read your story, read more of your story, donate to your team, or if they're even interested in starting their own team and coming out to the walk, that website is cctakesteps.org/Central PA 2022, or there is a link, if you didn't know, on this radio station's website. And so if somebody wanted to search for you, Caden, or your team, what's your team name?
The Hartleys. That's our team name.
Great. So again, if people want to know more about Caden's story, they can check out the Hartleys page or just support his efforts or start your own team. Or if somebody does want to come out, can register the day of events. Again, that's this Saturday, June 25th, and it's looking to be weather-wise a good day for a walk. It starts at 11. There'll be a DJ, other fun activities to check out, and some snacks to tide you over, or even a food truck if you're hungry for lunch around the time of the walk. I'm there too. I'm the MC. And Dr. Cunningham, Penn State also has a team on the walk. You're going to be there. You're also a sponsor. If somebody wanted more information on IBDs, other treatments, are you giving out information there at the walk? Is there a website someone should check out? What do you recommend?
Yeah, I believe there's going to be a table at the walk, so you could stop by and get some information there. Specifically for Penn State and our IBD center, which has information, again, just about our facility, but also IBD itself. You can go to the Penn State Health website, which is www.pennstatehealth.org. And then under services and treatments, if you scroll down, there's inflammatory bowel disease. There's actually a couple different links there that you can go to get information. If you're just looking in general for IBD information, I think one of the best resources that I like to give to all of our patients is the Crohn's and Colitis Foundation. So checking out their website, which is www.crohnscolitisfoundation.org. It's going to have lots of very factual, accurate information about where we are right now with diagnosis and treatment. They also have wonderful links off of there to a teen website called Just Like Me and a child activity center called IBD-Me, where our pediatric patients can get information that's appropriate for their level of knowledge, but also just for their level of interest. Not quite so dry, but it's a good source.
I did not know that. Of course, the Crohn's and Colitis Foundation is the parent of the Take Steps Walk. So all the money also raised at the walk goes to help their research and hopefully get to that cure. Now, Caden, if somebody was listening to this right now, is there any bit of advice that you would give to somebody listening? Maybe somebody that's 8, 9, 10 years old wondering what's going on with them and maybe their doctor's not listening to them too, what would you tell them?
Just like talk about it more with your parents and stuff, and just like honestly just talk about it and don't like be quiet about it because you're just gonna like suffer more.
Yep, get the help you need because it is out there and you can find it. Dr. Cunningham, anything else you'd like to add for the audience today?
I just think that it's good to bring awareness to this disease. It's often one of those silent diseases that people walk around with, and it causes them issues and problems and debilities in their life, but isn't seen on the outside, and so it doesn't get recognized as much as it probably should.
Great. Thank you again for your time. Dr. Bethany Cunningham, pediatric gastroenterologist with Penn State Health, Caden Hartley, Crohn's patient and this year's Take Steps for Crohn's and Colitis honored hero, and Natasha Hartley, Caden's mom. Have a great day.
Thank you. You too.
And I'm Christine Ricky. That's today's edition of People and Perspectives.
Thanks for listening to Central PA's People and Perspectives podcast. Each week, the Cumulus Harrisburg News Department will explore another topic that affects the people of Central Pennsylvania.